But there is something which makes this case much severe than a regular infection to the kidney, which is by itself a very severe disease. You see this? And this is extremely serious. This patient might lose this kidney if this infection isn't fixed, isn't addressed right away. So I bring to you today a very uncommon and serious case of urinary tract infection on a CT scan. This is a female patient that was complaining for about 7-8 days of urinary tract infection symptoms. She was feeling a burn when she peed, and she started feeling some kind of nausea and malaise, and she was weak and started to have constant episodes of fever. So she thought it would be best to go to the hospital, and the doctor ordered a CT scan with iodinated contrast. So it wasn't just a simple urinary tract infection. It was a very severe case and rare of a complication derived from some kind of acute infection to the bladder and the kidneys. We're going to read this CT scan. We have pre-contrast and post-contrast phases. So let's see. This is the pre-contrast phase. We use this phase to look for stones, kidney stones, obstructions, tumors, cysts, and all that good stuff. So you can see this is the left kidney and this is the right kidney. Just a heads up, the patient complains mostly of pain to the left. So it is a urinary tract infection for about a week with worsening symptoms and pain located to the left. So mostly, at least. So as you can see here, it is a female patient, and we have the left kidney and the right kidney right here. So the left kidney seems a bit different from the right. On this pre-contrast phase, you can see there is some kind of straining of the fat of the pararenal space. The fat adjacent to the left kidney is all strained, densified, as if it was inflamed, edematous. Also, you can easily see that the walls of the urinary tract, the urothelium, is thickened, but that doesn't seem to be any kind of stone, not hydronephrosis, dilatation of the urinary tract. We can follow this straining, heteroperitoneal straining of fat around the urinary tract all the way to the pelvis, to the left. This is left and this is right. I can also say that there is some atherosclerotic calcifications, and the urinary bladder seems to be a bit thickened. The walls of the bladder seem to be a bit thickened and irregular, as we might expect when the patient is complaining for 7 days of urinary tract infection symptoms. So there is straining all over the pelvic, fat and floor. This is expected also, but I can't really tell much about the disease just by looking at pre-contrast images of the urinary tract. So we have here a kind of nephrographic phase, a venous post-contrast phase of the abdomen, so we can actually see how the kidneys are all pacified, are perfused, are irrigated by blood carrying the contrast medium. So I can see there is a heterogeneous opacification of the kidney parenchyma to the left, with some areas that I can easily say could represent a acute infection, just like this. It's a partial heterogeneous perfusion of the parenchyma. So this is acute pyelonephritis. It's really not that severe, because it's quite difficult to tell if you are experienced. It's a great thing we have the right kidney to compare, and we can also confirm that the urothelium, the walls of the pelvis, the ureter, and the bladder are indeed thickened, irregular, and enhancing too much by the contrast medium, which tells us there is some kind of inflammation, some kind of disease affecting this anatomical structure. So there is pyelonephritis or pyelonephritis, which is acute inflammation of the left kidney and the urinary tract. But there is something we haven't seen, we haven't spoke of, which make this case much severe than a regular infection to the kidney, which is by itself a very severe disease. So this is it. You see this and this. So this is the right kidney vein. This is the vein that takes the blood from the right kidney. It takes it back to the inferior vena cava, the inferior vein of the abdomen. The left kidney vein is not properly opacified, which means it's thrombosed. Blood has clotted inside this vein, so this is a vascular emergency. This vein is thrombosed. This is one of the most serious vascular complications a kidney infection can lead to. So this is an acute vascular and infectious kidney. This is extremely serious. This patient might lose this kidney if this infection and this thrombosis isn't fixed, isn't addressed right away. Also, we can see that the pain could also be justified by acute thrombosis of the left gonadal vein. This vein right here is also thrombosed. It's also acutely clogged inside, and it takes blood to the left ovary. So this is an acute infection of the kidney, a pyelonephritis, complicated by a acute thrombosis of both the left kidney vein and the left gonadal vein. So this is a very serious and rare complication, vascular complication of an acute kidney infection. So if you enjoyed this video, I'm pretty sure you're gonna enjoy this one right here. And until next time, I'll see you.